has warned that the UK is back in the eye of the storm, with NHS staff anxious, frustrated and tired because of the pressures that they're under. Well, joining me now is Dr. Katie Sanderson from the Doctors Association UK. Good to talk to you, Dr. Sanderson. Would that describe it from your and your colleagues' experience, the eye of the storm again?
Yeah, talking to colleagues in London this morning, I think people feel it's worse than the first time round. I think it's really frightening. Because things are better organised and less chaotic, I think it's clear that just the volume of patients is becoming unmanageable and it's not possible to look after them safely. And the fear is that that's before we're even seeing people who've got infections contracted by mixing at Christmas. And I think there's the next couple of weeks, even 3 or 4 weeks, are going to be incredibly difficult, and people are very frightened that they're not going to be able to look after patients as well as they could, and that lives are going to be lost preventably because hospitals are overwhelmed.
That is incredibly stark, Dr. Sanderson. How so more worse? Just in terms of the numbers, we're more or less up to the levels we saw what turned out to be the peak in April, but of course we're only in the early part or maybe even the middle of winter, so you expect those numbers to continue to rise?
Yeah, I mean, case numbers are absolutely huge, and it takes days, sometimes a week, for people to become sick enough to need treatment in hospital. So I don't think we've seen the worst of it, and we're at a point where many London hospitals this week have declared critical incidents, haven't been able to admit more patients because they're full, don't have intensive care beds. And of course, in the initial part of that, it's possible to divert patients to other hospitals. But I think there's now pressure on most hospitals in London, some more than others, and there isn't a lot of capacity, and it's not as bad as it's going to be. And I think there's real fear. The patients coming in are very, very sick, and I think there's a lot of staff off sick, and people are really, really stretched. And obviously there comes a point where that compromises care. And I think many of us feel at the Doctors Association that we've really reached that point, and something quite radical needs to be done to try to reduce further infections and reduce rates, because otherwise large numbers of people who could benefit from hospital treatment will die preventably.
There is, Dr. Sanderson, I'm just taking all that in, there is a slight crackle on your line, but you are loud and clear. So just to say to our viewers and listeners, we're going to stay with you, because what you're saying is, as I say, so very stark. Are you beginning to despair in a way, Dr. Sanderson?
I think there's a sort of disconnect between public understanding and what is actually happening in hospitals. And I think that's because there's a lot of control of information. People need to know what is happening in their local hospital so that they can decide how to behave. Obviously, if people know that there is no space in their local hospital, they are less likely to behave in a risky way. And I think there's just real concern that people are working in these really sort of extreme conditions already, and actually that you just come out of the hospital and people have very little idea how bad it is. And I think it's really important that we're open and honest and transparent, and that people know what is happening, which is, you should go to hospital if you're sick, you will get treatment. But if huge numbers of people continue to contract coronavirus, there will be no capacity in hospitals. And as we know from the first wave, it's difficult to create large amounts of extra capacity because the number of trained staff is finite.
And that is your clarion call to members of the public. You've no idea what is going on in our health facilities right now, and you've got whatever happened over Christmas, presumably, given that lag, you've got whatever happened then to hit the hospitals and whatever will happen over the new year.
Yeah, and so I think if we as an association can say anything to the public, it's do everything you can to stop yourself, your family, your loved ones getting infected at this point, because health services are going to be extremely stretched over the next few weeks. And any infection that we prevent, I think we should be doing everything we can to.
Well, you couldn't be clearer, Dr. Sanderson. Thank you very much indeed for joining us. That's Katie Sanderson from the Doctors Association UK.